Hi guys, my name's Danielle. I'm our functional medicine patient coordinator here at Captivating, and I am going to talk a little bit today about how you do your at-home saliva test for cortisol and DHEA results. So with this test, we have everything that you need in the box. So we've got our saliva tubes, we've got our paperwork, we've got our directions, we've got our mailer, we've got another set of directions because we like to make sure you're really clear, and then we've got our tube labels. So first things first is your paperwork. You want to make sure that everything here is fully completed. So all of your patient demographics, sample collection time, we'll talk a little bit more about that in a minute. Relevant food intake, we're generally not doing this test, so unless you've been told otherwise, you can ignore this portion. Symptoms, 0, not an issue. 3, it's ruining your life. Menstrual status, regular, irregular, no longer, if that's relevant to you. Any hormone usage in the last 3 months, I think most commonly forgotten here are thyroid and hormonal birth control. And then here we're going to select your test. Generally speaking, that's going to be an adrenal check. And then you're going to sign and date at the bottom. And you want to make sure you do this the day you're doing your test, so the date and time matches what we have on our labels. So with this, we've got 4 tubes in here, 4 labels. Now, our first tube is going to be done 30 minutes after waking. Second tube, aim for noon. Third tube, somewhere between 3 and 5 p.m. And fourth tube, right at bedtime. Now, there's a couple important things you want to remember with this. The first is that for that entire day, no caffeine, no smoking, no exercise, nothing that's going to kind of skew those results. Now, 30 minutes prior to every tube, you're going to want to stop anything other than water. So no coffee, no chewing gum, no juice, no snacks. You can have water until you start spitting in the tube. Once you start on a tube, then no water until it's full. We just don't want to have too diluted of a sample for the lab to test. So for your first tube, we want to hit the 5 ml line. All of our subsequent tubes, the 3 ml line is fine. Now you'll collect these throughout the day. You're going to label them with the date and time, making sure that coincides exactly to your paperwork. There's no discrepancies. And then label it, seal it up. These will get frozen overnight. Now, whenever you're ready to mail, so if it's the next day or a few days later, if it's a weekend, that's no problem. You're going to pack everything back up in your box. All of your paperwork, your tubes, they're going to go back in here. This box is going to go in your bag. So your bag right here, and this is going to go to UPS. Now, results are going to come back to the clinic in a couple weeks' time. Few commonly asked questions with this. It does not have to stay frozen for mailing. That's no problem. We want it frozen until you mail it out. But once it's been dropped off with UPS, it's not cold chain, and that's no problem. Results will come back to us, and we'll discuss them with you in your follow-up appointment.